It's Europe's biggest specialist women's hospital, but its future is tonight uncertain. The hospital that was opened 20 years ago by Princess Diana has become something of an institution in the city, but plans have today been put forward to close the current site and move services to another part of Liverpool.
There are some problems with the services being delivered from a hospital that is sat on an isolated site. So women who require intensive care, for example, they have to be transferred to one of the other adult hospitals in the city. And the neonatal unit at the Women's Hospital just isn't big enough to cope with the number of babies that are there in a safe way.
There are 4 options being proposed. The preferred is to move the whole hospital to a new building on the same site as the new Royal Liverpool Hospital half a mile away. Option 2 would be to relocate to Alder Hey Children's Hospital. The other 2 possibilities would involve making improvements to the current Crown Street site. But they're plans that have been met both with surprise and alarm from some quarters.
Is your very first house?
Tracy is one of 40,000 who've already signed a petition against the plans. She says she owes hers and her son's life to Liverpool Women's.
The Liverpool Women's will always hold a special place in our hearts.
She almost died 4 years ago after giving birth prematurely to baby Lucas at just 23 weeks. She says her treatment was first class and doesn't agree there's a problem with services.
If they move it, we're going to come into more problems where it is now, they're saving babies' lives that don't exist in medical books. How can you uproot that and cram it into another hospital where it's going to generate more problems? I mean, the NHS is suffering as it is. It doesn't need any more added pressure.
The big question, of course, will be how to pay for these plans. That's something no one seems to have the answer for just yet.
The reason for change here isn't about finance, it's about clinical need, keeping people safe. But the truth is that moving to another site probably would provide the best value for money for healthcare in Liverpool.
Formal consultation isn't expected to start until the middle of this year, and it could be years before any potential new hospital is completed. But one thing bosses here are stressing tonight is that whatever plan is picked, it won't be the end of Liverpool Women's. Mel Barrow.